J9. It is really important that we follow flu vaccine advice for both children and adults to help us stay well this winter. The flu vaccination is especially important this year because if you're at higher risk from coronavirus, you may also be at higher risk of flu. And importantly, if you get both flu and coronavirus at the same time, you may be more seriously ill. The adults that should get the flu vaccine include people aged 65 years and over, pregnant ladies, anybody staying in residential care, and anybody that's looking after an elderly or disabled or sick person. All frontline NHS and social care workers should get the flu vaccine, but also if you're living with someone who is at high risk of coronavirus, you should get the flu vaccine. Those who are at high risk of getting coronavirus and who should get the flu vaccine are those with the following underlying health conditions: breathing conditions such as asthma, especially for our community, anybody with diabetes or heart disease, people who are overweight or have chronic kidney disease. If you suffer from any of the diseases or conditions listed here, you should get the flu vaccine. The flu vaccine is now available and you can obtain it either at your GP surgery or at a pharmacy offering the service. If you're an NHS frontline worker, you'll be able to get the vaccine from your workplace, and pregnant ladies can get the vaccine from their midwife. So please do ensure you get the flu vaccine this year if you are eligible. This will ensure that both you and those around you are given the best protection available. For further information, you can visit the website listed here. For children who should have the flu vaccine, it is important to remember that flu can cause a severe illness in children. Children are offered the vaccine as a nasal spray, and the reason they should have it is because they can spread flu very easily. However, if they receive the vaccine, then it will stop the spread to others and to more vulnerable people. The nasal spray flu vaccine is given to all children aged 2 or 3 years on the 31st of August 2020. It's also given to all primary school children in reception up to year 6 and to year 7 children in secondary school. The other children that are eligible for the flu vaccine include those aged between 2 and 17 who have any underlying long-term conditions, such as asthma, diabetes, kidney or liver disease. It's important to remember that the nasal vaccine may not be suitable for all children, but the decision about which vaccine they should be given, either the nasal spray or the injection, will be made by their GP or nurse. Depending on your child's age and the reason for their vaccine, they'll be given the vaccine either at school or at the GP surgery, but the most important thing is that they do receive the vaccine if they are eligible. And for additional information, you can go to the website listed here. Please all remember to get the flu vaccine if you are eligible to ensure we all remain as healthy and as safe as possible this winter. Thank you for considering this advice. J9.